The 7 bullet causes of disease. Number 1, key toxins. It can be heavy metals. It can be mercury. It can be lead, tin, antimony, cadmium. On the Gulf Coast, we notice a lot of those things that occur. Lack of adaptation, agricultural chemicals, solvents, cleaning agents, pollutants. A lot of those things are what are known as key toxins, and we have to learn how to eliminate those by either doing a detox every quarter or things like that will help our body not get a buildup of chemical substances within the body. Now, infectious agents like parasites, bacteria, worms, virus, fungus, and then of course we have certain inherited predispositions as well. But we have to look at ways of getting infectious agents out of our body or out of our life or from our surroundings and our environment. All right, so that's number 2. Number 3, ruinous lifestyle. Simple, right? SAD, the standard American diet. Why is it called SAD? Because it's killing us. All right? What we're doing now, we have 1 million diets out there. We have 1 million gyms out there. We're steadily gaining weight. We have more children that are overweight than they've ever been before. So obviously what we're doing isn't working. So we have to do more than what we've ever been doing before. We have to worry about number 4 is organs, right? Our organs, for some of us, have some kind of genetic predisposition, kidney, liver, or stomach, just depending on what our family history is. We know that that may be part of the problem, but most of what we're doing to ourselves is causing our organs to dysfunction in one way or the other. Our heart is not as good as it used to be. We have a bad diet. We put more stress because we smoke or that we drink and it affects our liver, or we have problems with certain different chemicals that may affect our brain or our gut. So we have to know that certain parts of our organs are dysfunctioning, and it may have to do with the nerve supply that goes to those organs. But we know that we have to look at some of those things. Now, number 5, what we normally don't look at is electromagnetic fields. Electromagnetic fields like microwaves and cars and cordless phones and cell phones and basically cordless towers for cell phones, things like that. We have to be concerned with electromagnetic fields, radioactive poisoning, things like that, and basically radioactive type information that comes into our body. Not much of us discuss that, but most of us have heard, hey, we shouldn't use a cell phone that much. Don't stand next to a microwave. Don't stand next to power lines. We've all heard of that since we were young, but most of us don't take that in. So that's number 5 of the 7 bullet causes of disease. So medically induced disease processes. Guys, it's very simple. The more medications you take, the worse you are. Most of you will never get off of a medication once you've been put on it because of a chronic disease process, because you're not changing anything to improve your health. So does that make sense? It could be x-rays. It could be suppression of certain symptoms, not taking the right supplements or medication. Supplements sometimes can be just as bad as a medication. So make sure you're taking what you need based on a blood test or some kind of reasonable information, and not just because somebody told you to do it. The last piece, number 7, consciousness. All right? We're talking about negative influences within the family, right? Within the environment of people that you work with, your church members, your coworkers. Negative influences within your close quarters, they give us that negative feeling. Somebody always putting you down, or you feeling inferior, or whatever the case is. Negative emotions cause disease. I just recently came across a study from a German oncologist off a study of 20,000 patients that he saw. He found that severe emotional stressors were followed by cancer within a couple years. So we know that our emotions and our consciousness play a very important part. So those are the 7 bullet causes of disease. Look those up, make a list, and find out how you can improve those areas so you have a better quality of life. We'll see you guys on your next Neural Effects Minute.